The vision of Iowa is that all children beginning at birth will be healthy and successful. We believe the first step to raising healthy and successful children starts with quality child care. In Iowa, we want child care to be a place where children feel happy, safe, and are learning. For children to receive care like this, parents need to recognize what quality child care looks like. So what do you say? Let's learn how to choose quality child care. The first way to find child care is to contact Iowa Child Care Resource and Referral. When you call the number on the screen, you will talk to a parent specialist who will gladly refer you to child cares that meet the needs of you and your children. When visiting the Iowa Child Care Resource and Referral website, you have access to child care referrals 24/7. The second way to find child care in Iowa is to visit the Department of Human Services website. When on the DHS website, you can use an interactive tool to locate childcare all across Iowa. When searching for childcare, you will find 5 types of childcare available in Iowa: centers, child development homes, non-registered homes, preschools, or family, friends, and neighbors. Centers can either be licensed with the Department of Human Services or follow the Department of Education Early Childhood Standards. If licensed by DHS, DHS is expected to visit them once per year. Centers are usually more structured and the children are grouped by ages. These group sizes may be bigger than an in-home child care. Children may have more than one provider during the day, and if one of those providers is absent, there will be a substitute to fill in. Anyone working in a center needs to have a child abuse history check, criminal background check, and fingerprinting completed. Background and fingerprint checks help parents know that the people working with their children are safe to be with. This helps to reduce the risk of abuse or neglect, and to make sure children are safe in their physical and mental health. There are also trainings staff must take when working in a center. Anyone working in the center and substitutes need to have a valid certificate in CPR, first aid, universal precautions, and mandatory child abuse reporter training. Staff working less than 20 hours are not required to have CPR or first aid. Child development homes are registered with the Department of Human Services. DHS is expected to visit them once per year. Child development homes may cost less and have smaller group sizes with children of many ages and siblings together. This kind of care looks a lot like a family setting with 1 or 2 of the same providers every day. A child development home provider's hours may be more flexible with possible evening or weekend care. But if a provider is absent, the parent may be in charge of finding other care for the child that day. Child development homes also must have background checks and fingerprinting completed. A child development home provider and people living in the home 14 years or older need to complete a child abuse history check and a criminal background check. The provider and people living in the home 18 years or older will also need to complete fingerprinting. Child development home providers are required to take trainings as well. Providers and substitutes need to have an up-to-date certificate in CPR, first aid, and mandatory child abuse reporter training. Non-registered homes can only care for 5 children and are not visited by DHS. They do not complete background checks. It is important to know that these people may have a criminal record and be considered unsafe for children to be around unattended. If a non-registered home is receiving state pay, they have completed background checks. These homes are also expected to follow sets of standards and expectations to make sure their environment is quality. Preschools have part-time and full-time programs that offer varying hours. They are typically open during the school year and are based for children ages 3 to 5 years old. The last type of care is family, friends, and neighbors who do not need to be registered, although they may apply and get child care assistance money if approved by DHS. Families may feel more relaxed with family, friends, or neighbors caring for their children. All of these programs must follow ratios. If someone is caring for over 5 children, they must be regulated by the state of Iowa and become licensed or registered. Ratios help make sure children can be watched at all times. Have your providers show you in their manual how many children they can care for and how they plan to meet their ratio. If you would like to learn more about ratios, visit this website. Consider staff turnover when looking at the ratios. If it seems like there are staff changes often, parents should think about the effect of this change on their child's care, education, and safety. When there is a predictable, constant routine and caregiver, children will feel secure. We suggest that you go interview possible child care providers. Ask to see the provider's registration or license and ask about their education and experience. This will give you an idea about their background and skills with young children. Child development homes and centers must also take training for professional development. Providers can take a variety of training with topics including child development, age-appropriate activities, plus others. Some providers may take part in training that can educate them on working with children with special health care and/or educational needs. If that is something needed for your child, talk to your provider. Child care providers can take part in Iowa's Quality Rating System. This voluntary program, known as QRS, helps them improve the quality of care and education they give to children. Families should know that providers who do QRS are trying to make their programs high quality. One way to make sure all children receive this high quality care is through child care assistance. Child care assistance is in place to help low-income families get quality child care for their children. If you'd like to learn more about child care assistance, visit the website you see on the bottom of your screen. Parents should not be afraid to ask a provider for a list of references. References can help parents understand the child care program. When parents are thinking about sending their child to child care, it helps to talk to other parents whose children have been or are in that program. Quality child care is not the sole responsibility of the providers or parents. This means that child care is a partnership between the provider and families. On days that are different than normal, the parent and provider should discuss and decide if group care is the best place for the child that day. Some providers you visit may have a parent handbook and written agreement between them and you. This written agreement sets the stage for open communication between family and the provider. This written agreement may include things like hours of care and fee schedule, days provider is closed for holidays and vacations, policy for termination, notification of fee changes, charges if a child is absent, early or late pickup charges, and any other additional activities available, plus their cost. All expectations should be talked about between the parents and providers. To keep this partnership professional and strong, confidentiality should be kept. When you step in the door with your child, you should be greeted by the child care provider and be able to use your 5 senses to see if children want to be there and if it is a place where children can grow. When kids are laughing, happy, joyful, enjoying the environment, and respecting one another, that is a sign kids are comfortable. Children should have a place to store their personal belongings, and parents should be able to view a posted routine of what their child will be doing that day. The routine should be flexible and meet the needs of all children. It is important to have furniture that is child-sized. Also, the toys and material should fit the children's ages. There should be enough toys for the amount of children the provider is giving care to. Providers should have planned activities that fit the ages of development of the children. These planned activities should explore their play setting, develop large and small muscles, support their self-esteem, include active and quiet play, encourage creativity, cultural awareness, and imaginative play, plus be indoors and outdoors. Children should also have the opportunity to make their own choice through free play. Free play allows children to explore, handle materials in a way that allows them to be busy, and make choices about how the play will happen. Providers are required to have first aid kits available in all areas where children are cared for, so staff members are ready to handle emergencies. These places include in the center or home, outdoor play area, vehicle for driving children, and on any field trips. If children need medication during the day, the parent must give the provider written approval, the medication must be in the original container with the label in place, and the provider may need extra instruction or permission from the child's health care provider. If a child has food allergies, parents should make sure the provider is able to meet the needs of this child. The provider should always have emergency medications on hand for this child. All kinds of medications should be stored out of reach of children. When it comes to safe sleep, all infants up to 12 months of age should be placed wholly on their back for sleep with no blankets or soft material in the crib to reduce the risk of sudden infant death syndrome. If a child's medical condition requires a different sleep position, there must be a signed waiver from a child's health care provider. Infants should spend no more than 15 minutes twice a day in restricted infant equipment such as swings, car seats, bouncers, and exercisers. Too much time spent in these containers can slow development of gross motor skills. Infants also need to have supervised tummy time while awake to help with muscle development. Recognize that emergencies do happen and make sure the provider has a plan. The provider should have an evacuation map and written instructions ready for all different types of emergencies. Some of these emergencies may require moving to a safe, clean location away from danger. If children have to be moved away from the child care facility during an emergency, parents should know the primary and secondary location where children may be taken. They should also know how to reach the provider during emergencies. There should be a fire extinguisher on each child-occupied floor, plus monthly drills practiced and documented for both fire and tornado. This helps children and staff know what to do if an emergency happens. Children should have well-balanced, healthy meals and snacks that are served in the right amount. This is important for nutrition reasons, but also gives children physical and emotional comfort in knowing that their hunger needs will be met. In addition, a menu should be posted in a place families can see so they can address concerns, include ideas at home, and involve children in nutrition. A provider may be serving well-balanced and nutritious meals by working with the Child and Adult Care Food Program or following the USDA guidelines on nutrition. Hand washing should be done when the child arrives at the child care program and before going home. It should also take place before using the bathroom, changing diapers, and eating. Plus, after using the bathroom, changing diapers, eating, and playing with pets. When it comes to diapering, there should be a clean, designated diaper changing station. The provider should use disposable gloves and sanitize and clean the station between children. By following the right diapering steps, the spread of germs is reduced. The buildings and grounds used in childcare, as well as vehicles used in transportation, must all be tobacco and smoke-free. Secondhand smoke is hurtful to the body, especially for young children whose bodies are still growing. Infants who are exposed to secondhand smoke have a higher risk of sudden infant death syndrome. As you can see, when it comes to choosing quality childcare in Iowa, there are many pieces a parent should consider. Our hope is that you feel more comfortable and confident in identifying a quality child care provider and environment. Because just like you, we want your child to be happy, safe, and learning.